Channel 114. BEACHE. Channel 114.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpot. There's cash to catch with just a scratch.
Good evening and welcome to another edition of Roundtable Talk. On this evening's program, we have as our guests the Chief Medical Officer, Dr. SIMONE BEACHE, and Infectious Diseases Specialist and Advisor to the SVG COVID Task Force, Dr. JERROL THOMPSON. Welcome, lady and gentlemen. It's been a while since you've been here, Doc, but you've been in and out, so to speak. Yes. Welcome back. A lot has transpired since you've been here the last time, which was probably about 3 or so weeks ago. Tell me, where are we as far as COVID-19 is concerned? Where are we right now?
Okay, Teresa, thanks for having me here. So right now, sorry, we have 52 cases total reported. You notice, compared with yesterday's dashboard, we have added 2 new cases, and this is from results that we got between last night into the morning. We have 37 of those cases have recovered, so we have 15 active cases now. No deaths. We have 53 cases pending and 177 persons in quarantine. So I just want to make a statement about the quarantine, in that we have taken a decision that as of tomorrow, we would no longer be listing the numbers in quarantine. And that is because we have a lot of persons, it's very fluid. We have a lot of flights coming in, and we have a lot of persons on yachts. And the quarantine period, which might be determined at the beginning of your visit, can change depending on the timing, especially with the flights, and because the quarantine is dependent on contacts. I just wanted to state that we're not going to be continuing to list the numbers in quarantine, because the quarantine can be from 24 hours to 14 days. And the keeping that on track, even though we are monitoring the persons, it is becoming extremely inaccurate to be putting a figure today, which continues into tomorrow, because it's changing constantly.
It's a very fluid situation. So in terms of managing those numbers, it makes
in terms
no
of
sense.
actually letting it be an accurate reflection over a 24-hour period, it's not what we would want. So we would be able to say, but in terms of it staying there, being published for 24 hours, it's the accuracy. is something we are concerned about because it changes within the day a number of times.
Okay. American Airlines reintroduced flights about 2 weeks ago, and 2 flights have since arrived, and the number of persons who are now positive have been identified as coming from those 2 aircraft. How has that process been going in terms of the returning passengers or visitors? How has that process been going, and what have been the main challenges associated with that?
So American Airlines came on the 11th, and the first flight, and the second was on the 18th. So far, coming out of the flight on the 11th, we have had 12 persons testing positive and 1 contact on the ground coming from that. I pause there because it is our under investigation right now about the last case which we got just in the last 24 hours from that flight, that it is a case that we think is a contact of someone on the flight. The person was on the flight, and we think that is a contact in flight. Okay?
Not on the ground.
Not on the ground. So we have 12 plus 1. Just as I said, it's really fluid and we're working it. In terms of the flight on the 18th, so far we are still at 4 cases from that flight.
4 cases?
Yes.
Okay.
We didn't. So it's significant because when we calculated for the flight on the 11th, we were coming up with 7.74%. But the flight on the 18th was much less than we anticipated. Because going into this, considering the increase in cases in the U.S., we anticipated. I was speaking with Dr. this morning. We anticipated cases, and that's why our focus was always going to be on early detection of these cases and the quarantining, and that's why the matter of keeping them safely quarantined, isolated, understanding that even when you get onto a flight in Miami and you have a negative PCR in hand, when you come off of the flight in St. Vincent, you have been exposed. And that detecting that exposure doesn't take place with the swab on arrival. That swab on arrival is going to detect anything you picked up 5 days in the 5 days coming. So therefore, we have to test another period after to detect what happened during the flight. So this has been our plan of really very tight monitoring and testing, recognizing that the exposure is going to take place on the flight. And we needed to be able to test at a time where we would have a proper yield. So the main challenge has been the ensuring that we pick up those cases coming out of the flight and maintain those positive persons in isolation and the quarantine of the others who might not even be aware that they're now carrying the virus, and the risk that they pose to Vincentians in country.
Before I bring in Dr. Thompson, walk me through the process of what happens as soon as a passenger arrives on the ground at AIA. What happens from there?
Okay, so I want to even go before that. So we have a online system where persons can register before they come in. And we would like persons to do that because you put in your information, you indicate whether or not you have a test done, and it gives us an idea of the risk levels, even from before, So we encourage persons to fill that out. We had some challenges. It's a new system. The internet didn't work all the time. Persons weren't accustomed. And so we've had some challenges with that. But that is being resolved. We're working with the developers for that. American Airlines also facilitated the use of hard copy forms, which were filled out. So you come off of the flight, and we were working with the AIA, attempting to ensure that there are physical distancing, everybody wears a mask, you come in, and then you are assessed by the healthcare workers. And Dr. Thompson actually has been there on both occasions. And the process is designed to determine your risk, basically from your questions, basically from taking temperatures, as even with limitations of that, and coming to a determination of the person's level of risk of being carrying the SARS-CoV-2 virus or for COVID, and also taking a swab, the PCR swab, where it goes into the nose and you take a swab, and that is sent for testing. So you either come in with a test result or a test is done at the airport. And then a determination as to your risk level and therefore your quarantine period is made. And a court order or a landing a health officer's order or a form which says that you agree to be in quarantine or isolated for a particular period of time is handed over to you. And that's a binding document.
Okay, we'll come back to talk some about that. But Doc, you have witnessed the process.
Yes.
You've been present on both occasions.
Yes.
What is your assessment?
Well, I think it is a well-crafted process that requires everything to work right. Let me say that a number of persons who attempt to get tests in the United States find that they cannot get results for almost 7 days. It's taking them a long time. However, a number of them are successful in getting their tests within the 3 to 5 day period that we require. And it's somewhat exasperating to some individuals. I've seen them there trying to pull up their results online, hoping that it came in on the day that they actually arrived, but it didn't. And as a result, they, even though they might have had a test 2-3 days before, they would still have to go through the complete process of getting a repeat test again. And so it's my hope that in the destination country, that persons are able to get a quick test, and that the quality of the test that they get, where they get it from, that test is authentic, and that they could get the proper result online. And we know, you've seen all these different type of papers and coming through.
To ask you, how do you know what is genuine and what isn't?
I'll tell you something. There are ways of looking at these things, and I've been assisting with looking at these forms, these testing forms, having practiced in the United States before, and you're able to see certain things. But the issue is not so much that these forms are not authentic. It's that we are able to recognize that some people have been properly tested, and that those who have not got their results back yet, we are then able to have them go through to the team. And I tell you something, it's a marvelous process, that whole team approach. Under Dr. Duncan, they do a marvelous job and so forth. The issue is they fill out a form. They're supposed to fill out a form before they leave the United States, or in Miami airport, or somewhere on the plane. And some of them do not fill out those forms. If they fill out the form, as soon as they arrive at the medical team, they're able to pull it up on the computer, right? And they're able to see all the information. If the information is not there, they have to now go and fill it in. And that takes the time. That takes a lot of time to go and punch it in, or they have to punch it in after the person have passed through. That slows down the process. But I would say that if individuals can get a test before they arrive, within that 5-day period, it would make the process a lot easier. Now, it is quite unfortunate that coming through the Florida, coming through Miami, we know that Florida is a hot spot. And there's that risk. There's that risk.
We'll talk some about that when we come back from our first break.
One scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpot. Loaded with lots of cash prizes. $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpot. There's cash to catch with just a scratch.
Welcome back. And Dr. Thompson, just before the break, we were talking about some of the risks involved in signing of the form.
Well, it is more, no, I was saying that, we know this thing, originally the emphasis was on China and Southeast Asia. It shifted to Europe. Now it has shifted to the Americas. South America, Brazil, Peru, those countries, as well as North America. Canada, to a less extent, their curve has really certainly flattened, but it's the United States. And a lot of the persons now looking to travel to St. Vincent, historically and so forth, even though it has been the UK and people still trying to get from the UK, it's now currently the US. And we have to be prepared in the same way that several months ago we dealt with the sailors. We were able to successfully bring them and students back to St. Vincent. We had some positive cases. And so in terms of people coming back in flight, I believe that we can do this again, but there are some risks and there's some challenges. And we have to accept that we are going to have 5, 6, 7 positive cases on a given flight, as much as those. The issue is that in that flight, unfortunately, sitting behind or next to or in front of a person who's positive, you can also, you're at risk of at this present point in time, if I had an opportunity to fly, I probably wouldn't fly, I probably wouldn't recommend persons flying. I've got to say that. But people are motivated by funerals, other issues, businesses, and so forth. And we understand that. And I think that there is a risk. And that is a risk that's headed. But I really have to applaud the health team that's looking to manage this. And it's unfortunate, I got to say, that we know that the cases are going to go up, but it's going to come across as if there's some spike here in St. Vincent Grenadines. But these are managed increases. And the number of cases that we would have hoped that there would be 0. But I think we can expect that with each flight, there may be a few cases there on those flights.
Okay, we brought the sailors back, and this seemed to be a very successful operation. What is the difference here? Because there seems to be some measure of treatment difference. I don't know. What's the difference?
I think, Simone, if you tell me, with the sailors, in one case where we were able to get them to test the sailors on the ship. We were able to see some had previous infections, and we were able to pick up the active cases. In this situation, it's really dependent on their ability to get tested abroad and then in an aircraft, the air. You know, we're now realizing something where, you know, COVID-19 is not airborne, but there's these micro aerosols. And in a plane, a closed compartment, it seems that there is that risk of being able to pick up the virus if somebody who's positive very close to you.
And I would also, the difference too, as you said, we were able to test the sailors. They were in a closed environment. They were confined. And then once we were able to test them before they left this environment, this closed area, this controlled area, we were able to select those persons who we needed to have in isolation, or even the associated ones in quarantine. And in the group that was most, the highest risk group of sailors, we were able to identify that high risk group, and we were able to put them in a controlled quarantine facility, an isolation facility, where the risk of them there wasn't the risk of them leaving. The lower risk sailors, we allowed them to go home after testing and to continue their quarantine there. And so what we are doing, so that was there, the controlled quarantine, the controlled isolation, and that is what we have now moved to in this. And you know, when we speak about the new protocols, because it's only when you can have that really tight control of isolation and quarantine, but especially in terms of the quarantine and knowing who you're dealing with, that we would have the success of containment. So the sailors, we went through testing on board, testing before you left. We put you in if we know you're high risk because of your antibody testing as a screening process, we put you in a facility where we can keep an eye on you. And that is why we are moving towards that now, because as we said, the testing that is being done before arrival, the testing that is done at arrival, takes some time to reveal. It's what happened at that particular point, but it doesn't cover the space before or the space after. And so in order for us to protect everyone else from what might be brewing there that hasn't shown up as yet, you need them in a controlled environment. And that's why we have to move in this situation with persons coming from such a high-risk area to a controlled quarantine facility.
How do you respond to people who say that someone takes the test in, say, New York or Boston and travel to Miami and then on to St. Vincent, that anything could happen in between, and seem to think that the system of having, the earlier system of the 24-hour quarantine was not realistic? How do you respond to that?
I think that, there's some value to that. And that's been changed from 24 hours to 5 days. I think that understanding has taken place. And that is because mainly everybody has not gotten tested. If everybody got tested in that period of time, there would be a significantly reduced risk. There would still be a risk of catching it in the airport or on the way down on a plane after they have had that negative test done in the United States. They would still be, over the next couple of days, at risk. But there are quite a few individuals who have not gotten the results of their tests. And I think that even if you have a negative test and you're sitting next to somebody who has not had a test and they're positive, you are now at risk. So that's what the situation is. And then I got to say, there are some persons, I understand the alarm. How can you get onto a plane and you're told to wear a mask and you are refusing to put on a mask? How can that be? You know what I mean? You know, that is one of the requirements we're finding now, that wearing of a mask is really a critical entity as part of the whole scheme.
And we want to talk.
Terms of putting on a
we
thing.
want to talk a lot more about that. Someone wants to know, what are the protocols for persons coming from England?
Okay. I just want to jump into something. Just jump back there. Something that in the question about the 24 hours, because even though the protocol says that you will be in quarantine for 24 hours in terms of the results, we also did an individual assessment of your risk level. And even though we had persons coming in and we said that it would just be for the 24-hour period, if you were assessed as being of higher risk, you were given a longer quarantine period. And so what we have since done now is to be able to really guard that quarantine period. Coming back to England, England is not listed in the same category as the US as this high risk. Somebody coming in from England falls into the other category, the original. So you need to come in with we would like you to come in with your PCR test done. If you do not have it done, it will be done on arrival, and you will remain in quarantine until that result is ready. That should be between 24 to 36 hours. And still, your risk level will be determined by the port health officers on arrival, and that will determine your quarantine period. So if you're coming out of England, but you are coming, you will say somebody who worked in a prison, or you worked in a nursing home, both high-risk areas, you would get a different quarantine period than, say, somebody who is coming from somewhere that we determine is a lower risk area. So the final determination of risk is going to guide the quarantine period which you would be given and which would be required by law because of our revised public health legislation.
Okay, now it's no secret that quite a lot of people have not been adhering to the protocols, in particular the quarantining. Why have the authorities been more rigid and stern in enforcing the law?
So the law allows for the prosecution. The prosecution can only take place after the quarantine, in terms of you have to take the existing law, to take the person to the court, and you have to lay charge. I don't know the exact process, legal process, but it is something that is going to take some time, and it can only be done when the person can safely, because if the person is supposed to be in quarantine, you don't want that person mingling with others. So that is a challenge, and so there's consideration to the sort of ticketing thing, which would require less of an interaction with. So the existing legislation would continue, but then this other would allow for a faster turnaround.
More immediate.
But even then, as you punish someone for it, as a health practitioner, my concern is the exposure of that person to others, and therefore the transmission of an infection. And so that our emphasis is on trying to educate and encourage people to understand that you might be exposing your child, your grandmother, your wife, who you dearly love so much, and therefore you need to stay in. And if it is that persons are not going to voluntarily do that, even though you're on a mandatory quarantine, which means it's not voluntary, we have to move now to where we enforce that quarantine by physically having you in a manageable place where we can monitor.
Let me see. I think
Doc,
that,
hold that thought till we come back. We'll take a break and be right back.
1 scratch card, 3 games, 16 chances to win. Win with a top prize of $125,000. Unbelievable but true. It's the new $10 scratch game. $125,000 jackpots, loaded with lots of cash prizes: $100, $1,000, $10,000, and $125,000. Get your ticket from any lotto agent or scratch runner. $125,000 jackpots. There's cash to catch with just a scratch.
Welcome back, Doc. Before we took the break, you wanted to expand a little bit more on the point Dr.
Yes, I
was making.
I wanted to really re-emphasize that the approach has been that of moral suasion, trying to encourage individuals who are returning, the sailors or persons who are on these flights, they're responsible. But on investigation, I've detected something addition, that their relatives, the persons who may be here, they too need to be part of that process. I've found individuals saying, "What are you bothering? We don't have anything here. Don't worry with that, man. But let's go out tonight," and so forth. And that has loosened the screws and encouraged these individuals to break what we've imposed a moral suasion. And I think we have to make an appeal to the individuals who are picking people up at the airport, the individuals who are there eventually to assist them in one way or the other, to encourage them to stick with the quarantine process and not to break it. Don't take them out to that barbecue the same night. Don't take them to a wet fete. Don't take them to an event and so forth because you haven't seen them for such a long time and you miss them and so forth. You can do much more by making sure they follow that particular protocol that's been put in place.
I know that this reintroduction of flights, it was a 3-phase or 3-pronged approach.
2-phase.
2-phase. Let's talk a little bit about those phases and what they entail.
So the first phase, which is nearly finished, was July 1st to 31st. And during this phase, everyone, no matter where you were coming from, everyone had to either have a PCR result done within initially 3 and then went to 5 because of the difficulty in getting tests, or you had a test done on arrival. And that was supposed to go on until the end of the month. And then from August 1st, looking at the figures we were getting, we got through July, we would then decide on phase 2 where we had what we were saying would be the CARICOM bubble because of the history of controlled coronavirus in some CARICOM countries, and that those persons would then be able to come in without testing and would have no quarantine. So basically they will behave as they used to before coronavirus. However, persons outside of that CARICOM bubble in places thought to be high risk would continue to require PCR tests, either result or a test on arrival. As we are moving forward, and I'm sure you would know that some countries, for example, Barbados last week, did away with that bubble concept.
That bubble was burst.
A bubble burst. And we are thinking, we are considering, but I think it's going to be very much on a island by island situation basis. And we might actually have to extend that testing. But it's very much going to have to be as we move along and as we see what's happening in different countries.
We move now to the new protocols which will be introduced beginning in another week or so. or this Saturday?
This Saturday.
coming Saturday?
This Saturday, depending on what happens with the flight,
with
considering the storm.
The pending storm.
So anybody coming to St. Vincent this Saturday from the United States on that flight, or any other commercial flight coming out of the U.S., because we have some persons coming in on JetBlue to St. Lucia, and then they will come over, or they might come in on, the only JetBlue flight going into Barbados. But anybody coming on a commercial flight out of the U.S., either directly or via another CARICOM island, must have a PCR result in hand. So if you don't have it, do not come. So you have to have the PCR result in hand. You have to have a reservation at one of the identified Tourism Authority, Ministry of Health approved quarantine hotels for 5 days at your expense. And as I said before, this is because we need to have persons in observed, adequate quarantine for at least 5 days so that we can determine what is their risk, because we will be doing a PCR test on arrival. So even though you have the PCR test done in the States, that is to basically say, if you have thing, don't come. Okay? So if within 5 days you do a PCR test and it's positive, obviously you're not going to come. So that takes care of that period. You come in, you do the PCR test on arrival, you go into quarantine in a controlled environment in a hotel that you are paying for 5 days. And during that time, we will get that result of that entry PCR, which will then say, did you develop, were you positive, but they know while you were coming down, and who around that person on the plane would have been exposed. So that we'll be able to tailor our further quarantine based on that knowledge. And between day 4 and 5, we will do further testing, whether it's a repeat PCR or it's an antibody test, to get a final idea, because some persons, obviously, if I'm exposed on the flight, I'm not going to have a positive as soon as I land. That positive will come up during day 4 and 5 testing. So that's the protocol. At the end of day 4 or 5, any further quarantine will be determined, whether it's no quarantine, whether it's 7 days, 12 days, to a total of 14 to 21 days. That's the new protocol for persons coming out of the United States of America.
So somebody asked me this morning, so what if I arrived without any of these things? What happens?
How did you get on the flight? But if you arrive without any of these things, you will be placed, you will have a PCR done, you will be placed in a facility at your cost. At your cost. There are certain ways we will be able to ensure that the fee is paid. But, I mean, we don't want this to be a certain battle as, bad John, I arrive here, see what you're going to do with me. But there's a reason for this. We need to protect our 110,000 persons in St. Vincent and the Grenadines. We need to protect them. And the only way we're going to do that is by ensuring that we contain whatever persons are bringing in, and we really, this is not the time, as Dr. Thompson said, this is not the time to come for a weekend, this is not the time to come for something that is not an emergency. This is emergency time, because when you step on a flight, you might be coming from a low-risk area in the States. You travel from that low-risk area through high-risk areas onto an enclosed environment for 4 hours, you are increasing your risk of getting something. Why would you do that to yourself unless it was absolutely necessary?
Okay, well, we saw that question. That question was actually answered. If you don't have the money and you have your own house, we basically answered that. Whether you have your own home or not, you still have to do the 5 days in an approved hotel. Okay, so that answers that. Doc?
Yes, well, you see, from our experience, persons haven't been sticking to it. they have been slipping out after 2 days and driving around the place, sitting at bars and so forth. Unfortunately, this has been the observation of the population. It's unfortunate.
It certainly is because, as you said, it boils down to personal responsibility and to our family and friends insisting that we do these things. What happens to flights out of Canada? Are the protocols similar?
No, so the protocols for flights out of Canada would be as we had for last weekend. So you come in either with a PCR test or you come in without it and you have a test done on arrival. You go into quarantine for a period of 24 hours or determined by the hotel staff to in terms of your risk level. You await your results. We wait until we clear the flight because that's a lot of the quarantine period is to determine, as I said before, who is exposed, who are the positives on the flight. So we need to establish that instead of letting everybody go out and then we have to try to find them. So coming from Canada, the original protocol is in place. Coming from England, this protocol is for persons coming on commercial flights from the US.
So the 24-hour quarantine remains in effect for passengers.
It remains for
once you're not coming out of the
in.
United States of America.
Mm-hmm.
Okay. Doc, I want to go back to the basics somewhat. Remind us again about the modes of transmission of the virus and the effects on the body. Because I'm hearing too many people saying we don't have not name corona, that kind of thing. So please explain.
Well, we have been learning a lot about the coronavirus since we first started to hear about it. And there's been a few changes. Some of these things are not stuck in concrete. They're constantly changing. We know that the washing of hands, the use of hand sanitizers, the physical distancing has always been important. We now want to have a greater emphasis on the use of a mask. For those persons who are going into public places, we expect that what will happen, a number of I was down at the brewery today, and I had my mask with me, but I left it in the car, to be true. And when I went there, they said, you can't come in, you have to have a mask. So I went back to the car, and I was able to put on my mask and get into the brewery. I would want to be able, if I'm going to the bank, if I'm going into somewhere, to be able to get in there, and if the passport is going to be the use of a mask, then surely I'm going to use a mask. I'm a little alarmed by, a number of the supermarkets and the stores. They've
slowed down.
They've slowed down. And I think our human nature is that we want to get back to normal. But seriously, there is a new normal. There is a new normal. For those persons who are working in a closed room, air conditioned and so forth, we do also know that even, as I said it before, even though the virus is not airborne, it can shift around in terms of small aerosols floating around and so forth for a lot longer than we had expected, And we don't know if that leads to transmission. We don't know. Maybe we'll find out some point in time. But having a mask is going to certainly help. And a mask is primarily going to help. If I have COVID-19, by wearing a mask, I'm going to protect you, protect everybody else, and protect my family members and so forth. And it's my responsibility to do it. It's my duty to do that.
When we come back, we'll talk some more about that, and we'll answer some of the questions that I see are popping up. We'll be back in just a moment. Welcome back. I'm going to give you a couple questions that I saw. Someone wanted to know if a family of 4 or 5 can quarantine in the same hotel room together. Somebody also commented that you ask people to quarantine for 5 days and nobody checks in on them. I don't know if you could respond to that as well. Someone else asked, okay, why not stick to one set of protocol? It is encouraging persons to ignore them. We must remember that this is an airborne disease, if I'm to believe what I have read and heard from international bodies. Doc, you want to start with the last one?
Well, no, I don't think it's airborne in the sense of what I know from infectious disease point is airborne. But by coughing, by talking loud, by singing, I'm creating aerosols, small little tiny droplets. And what we're saying is that they are hanging around in the air for a little while. Question whether they're airborne or not. I'm still going back to let us wear a mask. And that solves that particular problem. You know what I mean? And I think we just got to focus on that.
Okay. The quarantine, if that family is a family, so they're going to continue together. And if it is that they stay in a hotel room, they can all stay in the hotel room. They'll be easy to track. The thing is to be able to contain and to be able to easily contact trace. So if that's what they need to do, they can stay in the room together. In terms of changing the protest constantly, this is a continuously changing environment. This is a continuously changing disease, and what we're learning about it. And we put certain things in place, and if we realize that because of poor compliance, because of the disease spread, that is not sufficient, we will have to change. So just as we said, on the 31st of July to the 1st of August, we're supposed to, we intended to, we planned to do something, but even that cannot be certain at this point. Okay?
Okay, and the person who was saying that people are placed in 5-day quarantine and they don't hear from us, I don't know that you're obliged to be in touch with them every single day. Resources certainly would not allow for that.
And I know some persons actually expected to see a healthcare provider at their doorstep every day. We're not that, as you said, human resources won't allow for that. We make calls. Sometimes the calls might not be every day, but if you're in quarantine, you're a healthy person. If you were ill, you would be in isolation, and that would be a daily contact. If you're in quarantine, you're a healthy person, and we would attempt to make contact with you every day, but sometimes we do every other day. So it would depend. It would depend.
Okay? Great. I know you answered this earlier when you gave us the status update. How many cases do we really have? And I'm sure I heard you say there are 15 active cases?
There are now 15 active cases. And can I go into that in terms of...
Okay, so we have been doing our own testing. I mean, the last time you were here, you did indicate that I think next week or something to that effect. How has this process been going?
Okay, so again, this is a new stage for us. Previously, we sent all of our swabs down to CARFA, the public health, their public health lab in Trinidad, for tests to be done. Now we have our own lab, and we do testing here. We send some of our tests there. We, over the weekend, in discussions with CARFA, we went from a process initially of sending all. Then we went into a process of saying, they said that we should send a proportion of them. And then we decided just this week that we are going to go back to sending all. And why are we doing this? Because we have determined that there needs to be a multi-tiered. We started talking about a multi-tiered system of testing because we need to increase our level of certainty. So we're testing here. We get one result, and that will be issued if it is a positive result, because we have to precaution, we have to move quickly on that. We issue that result as a preliminary result, and then we send the samples go off to CARFA. That takes typically 24 hours, to get the results back. And if there is a different result. So it's fine. If we have a result here and CAFA has a similar result, we are fine. That's the result. But if, for instance, we get something that's not similar, therefore we need to determine what is the result. Okay, how are we going to manage this? And that's why we've been talking about a multi-tiered system where we will do another test, whether it's a test, another PCR, or any other test. And we also, as I said, if it's a preliminary result, we move on contact tracing. We check other persons. Are other persons carrying the virus? Other persons showing evidence of exposure? And based on these multiple tests, we will then make a determination, even as we ensure that there's active contact tracing going on and containment. Because our aim at the end of the day is to ensure that we identify persons and we contain spread and we ensure that persons remain healthy and anybody who is at risk is dealt with. And so that is the process. So sometimes you might have some queries. Somebody might say, oh, I was told I was this morning, and then you'd call back and you're now saying, I am this. And so this is why we might have that sort of what might seem as uncertainty, but rather it is out of an abundance of caution that we have implemented this system of multiple layers of testing, so that when we say you are clear or you are not clear, this is on the basis of significant number of testing so that we get the best results.
So it is safe or fair to say that we can end up having false positives as well as false negatives from time to time.
Yes, and that is standard actually.
Yeah.
For the PCR test, which is the gold standard, you have a range of between 66 to 86% of sensitivity. And that basically means that you can have between 33 to 14% of false positives, meaning that the test can produce, because yes, it's a machine and all of that, but there are many different factors that go into the accuracy of a test. And so if you have a test with a range of that, granted you might have a facility that is at the top end with very few false positives. But when you start adding tests, different tests, you increase the likelihood of coming up with a true result. And that is our aim, to be as accurate as possible because of the implications to health of the individual and everyone else around.
Okay, 2 questions. Someone wanted to know the price of the hotels. Of course, we won't know that. They're approved hotels. If you go on the website, SVG Health website, also on the Tourism Authority's website, you will see the list of approved hotels, and you can make contact with the hotels yourself. Someone wants to know, why have the health officials changed their protocols from a 14-day quarantine period when science and statistics suggest that this is best? Let us recall that case number 3 arrived in SVG mid-March and tested positive 2 weeks later, and also one of the repatriated sailors who arrived in May tested positive 12 days later. So why now is there talk of 24-hour and 5-day quarantine periods?
Okay, so as I said before, the 24 hours is to allow us to get the results. And as I also said, the quarantine period is not fixed. So depending on the risk level. So for example, as I said also, somebody who is coming out of, say, a healthcare worker, they have a much higher risk. And if somebody was to, we were to look at the new protocols we have produced, we actually say that persons are going to go into a 5-day quarantine in a paid facility of their own, and then at the end of that period, the health worker will make a determination as to whether or not they will continue in 14 to 21 days further of quarantine total. So we are quite aware, and we know. I mean, I remember at the beginning of this process when St. Vincent was the first one that asked CAFA to do asymptomatic testing. There are still countries in the region where you only get a test if you have symptoms. Has not been the position in St. Vincent. We have the majority of the persons, when we were talking about that, the majority of our persons have been asymptomatic, and we have been tested. So we are working on our experience, on the science that says that, yes, you can have somebody, we know we can have somebody up to 21 days. The last case we just checked was somebody who came in on the 11th, and we did the test on the 7th for that person, and that person is coming up as positive. Okay? So, I think it's even longer than that. But we are aware of these risks, and that's why nothing is set in stone, and that is why we will continue to monitor. And even after we let you out of that 14 or that 10 or that 21-day quarantine, we advise you that if you develop symptoms, and we know about asymptomatic persons, that you should contact us. Okay?
Okay, as we wind down this evening's program, we have had no serious illnesses. We have had no hospitalizations as a result of COVID-19. And more importantly, we have had no deaths so far from COVID-19 here in St. Vincent and the Grenadines. I think that is quite a bit to be thankful and appreciative for so far.
We want to keep it.
Before you guys leave, is COVID-19 under control in St. Vincent and the Grenadines?
I would say it is, and we have to do our utmost best to ensure that it continues in that way. And that is why we have implemented these new, what is our greatest risk now of introduction? Persons coming from the United States of America. What do we need to do? We need to do what we can to ensure that we keep things contained. And it might seem extremely harsh to some persons that we would say you must stay in a hotel and you must pay for it at your... But that is what is necessary. This is what we have determined is necessary to maintain that containment, that control.
Yeah. I would say that this is a new normal, and COVID seems as if it's going to be around for a long while. For persons who catch COVID naturally, it doesn't seem as if the antibodies last for a long time and may be protective. So we're tracking what's happening with vaccines now. We're tracking what's happening. There's a lot of exciting things, although it's still very early days. I've said I'm looking to get mine. See, well, I would be one of the first. You know, I'd be prepared to get the first jab. But I think that this is the direction we're looking for, so that for most of the rest of the year, you know, and into next year, we are going to be dealing with COVID-19. We're going to see our relatives trying to return to St. Vincent for whatever reason. We're going to see students, and we're going to see other persons coming back for all sorts of different things, business and so on. And we're going to have to deal with it. And the protocols we put in place are measured, they are robust, and we have to be able to adjust them and change them and put them in place with the level of force that we need to. And I want to appeal to everybody once again. You know, let us go back to basics.
Yeah.
You know, I'm going to be taking that example. I'll be wearing more of a mask. I want you to do that too.
And on that note, we say goodbye. That's the end of today's program. Thank you. Amazing. Dr. JERROL Thompson, and of course the CMO, Dr. SIMONE KEIZER BEACHE. Thank you guys for viewing. We will be back next week. This is Teresa Daniel wishing you a very pleasant Wednesday evening. Goodbye.